Hello, welcome to Salinas Valley Memorial Healthcare System's Ask the Experts. I'm Claudia Otero. This afternoon, we're focusing on men's health and prostate cancer. First, I want to introduce to you our experts. Joining us today is Dr. Kenneth Biehl. He's a radiation oncologist at Coastal Radiation Oncology Salinas. He also sees patients at Salinas Valley Memorial Healthcare System. He joined SVMHS in 2012. Dr. Biehl treats patients with many types of cancers. He is board certified by the American Board of Radiology and is a member of the Medical Board of California and of the Radiologic Health Branch for the state of California. Joining him is Dr. Peter Oppenheim. Dr. Oppenheim joined the medical staff of Salinas Valley Memorial Healthcare System and Prime Care Medical Group in 2004. He is board certified in family practice by the American Board of Family Medicine. Dr. Oppenheim, his medical interests include preventive care with an emphasis on healthy lifestyle. Now, thank you very much, both of you, for being here today.
Thank you. It's
Great.
a pleasure.
Great to be here. Thanks for having me.
Of course, we're excited. We have some great questions, great topics. Before we get started, for those of you who are watching on Facebook, please feel free to share this link. And of course, if you have any questions regarding prostate cancer, please send them our way. And then our experts will answer those questions towards the end of this presentation. So let's get started. Dr. Oppenheim, let's begin with you. What are the most common illnesses and or diseases that affect men?
Sure. Thanks for the question, Claudia. So the top causes of death for men are what we see every day. It's heart disease, so heart attacks, cancer, particularly lung cancer, colon cancer, and prostate cancer. Unintentional injuries is a major health concern for men as well. Stroke, COPD or emphysema, other smoking-related lung changes, diabetes, pneumonia, suicide, kidney disease, and Alzheimer's are sort of the top causes of death. Health concerns, though, for men do vary based on age. For example, accidental injury is more common in younger men, whereas the other more chronic medical conditions are more common in older men. Depression and suicidality, however, do affect men of all ages, and so that's an important thing for men to be aware of. This is pretty much mimics the same diseases that we see in women, but there are obviously some diseases that occur only in men, such as benign prostatic hyperplasia, prostate cancer, and testicular cancer, obviously because women don't have those organs.
Okay. Heart disease, it's more common in men than women. Why is that? And what are those symptoms that men should be looking out for?
Yeah, unfortunately, we do see more heart disease in men, predominantly due to lifestyle factors. Men tend to have less healthy lifestyles than women when you look overall. That's not to say that there aren't men out there that do live a very healthy lifestyle, and if you do, great, keep at it. I encourage you to. But unfortunately, when you look at large populations overall, men tend to smoke at higher rates than women. Men tend to consume alcohol at higher rates. We do say that moderate alcohol consumption in men is up to 2 drinks a day or 14 drinks for a week. In women, because of the way their bodies are and the way their bodies metabolize alcohol, that's only 7 drinks a week or a drink a day. But men do tend to drink excessively more often than women. Men tend to exercise less than women. Their nutrition and nutritional intake tends to be less healthy. And they tend to have other concurrent diseases such as diabetes or hypertension at a higher rate than women. And when men do have diabetes and they do have hypertension, they tend to be less well controlled than women of sort of age-matched groups. So that's sort of the reasons why we see heart disease more predominant in men. Unfortunately, though, it's not a race, but unfortunately women are catching up. When you look overall in the trends over the last few years, women are tending to reach male levels of heart disease and severity, but they haven't quite caught up yet. So it is still more common in men.
And so this brings me to the next question for Dr. Biehl. You know, how often should men, well, and I guess women too, I mean, how often should, but since this is about men, should they be seeing their doctor? Because they should be undergoing certain screenings, right? So can you elaborate on that?
Sure, yeah, I recommend that every patient see their primary care physician once per year at a minimum. Depending on health problems and family history, we often recommend more visits much more often than that.
And you just mentioned family history. So what if there is a history of cancer, whether it's the grandfather or the father or maybe a brother? How often, again, should men and women be going to see their doctor? And what are those screenings?
Well, usually, just having a family history doesn't mean you have to see your doctor any more often, but it does sometimes adjust the timing of the screening for cancer. For men, there are three main screenings for cancer that we're going to talk about today. First, for all men, we recommend colorectal cancer screening. Second, for lung cancer screening, we recommend CT scans for former smokers and current smokers. And then for prostate cancer screening, we recommend that in selected men.
Okay. We should probably also mention, and I think you can probably elaborate to this, recently the U.S. Preventive Services Task Force updated its guidelines for colorectal screening from age 50 to age 45. They also recommended follow-up screenings every 5 to 10 years.
Yeah, so the age for the screenings depends on a number of different factors, including family history and other medical conditions. Primary care doctors are there to help the patients figure out when and how to do those screenings, and which particular type of screening is going to work best for different patients. And over time, we've been better able to determine exactly when and how we're going to do those screenings. Recently, in the past couple months, there's been a reduction in the age for men without any family history or other comorbidities to begin their colonoscopies or other screenings for colorectal cancers, and that's moved from 50 down to 45, which has affected me personally in what I need to do. So it's a moving target, and as we get more information, we change our recommendations, and that's just what happened recently in the past couple months.
Yeah, and we actually did start adopting the new guidelines at the SCMC Prime Care offices as well. So we are encouraging men and women starting at 45 for colon cancer screening. And Dr. Biehl did talk about it. There's different ways to check for it. And you can talk to your doctor about whether colonoscopy or one of the stool-based studies is appropriate for you.
Okay. Really good information. Thank you for that. Earlier, Dr. Oppenheim, you mentioned that a common health problem for men is enlarged prostate.
Yes.
Why does this happen, and how do you treat it?
Sure, that's a great question. I'm going to answer you as best I can. So first of all, it is a very, very common condition. The data and statistics suggest that about 70% of men aged 60 to 69 have BPH or benign prostatic hyperplasia, and about 80% of men over age 70 end up having symptomatic BPH at some point in their life. So it's certainly very, very common. The causes of BPH are not entirely understood, but there do seem to be a combination of hormonal factors, inflammatory factors, as well as possible autoimmune factors that seem to contribute to increased prostate cell production and growth. So what I tell folks is while there are multiple factors, some of them are modifiable and some of them aren't modifiable. So some you can make a difference with and some you can't impact. So things that you can do to decrease your risk of having BPH as you get older are addressing the following. One is obesity. Obesity-related syndromes such as glucose intolerance, elevated cholesterol, and hypertension, all are associated with increased rates of BPH in men. So getting to a healthier weight, eating a healthier diet will certainly help you not just for those conditions, but also for your prostate as well. Diabetes is associated with BPH, so treating your diabetes or making lifestyle changes to basically cure your diabetes, which with appropriate diet and exercise can happen sometimes, will help decrease it. Lowering your alcohol and caffeine intake can decrease your risk of BPH, and increasing your physical activity will also decrease your rate of BPH. So all of these things, sort of being more sedentary, eating more, having an unhealthier lifestyle, does seem to increase your rate of BPH. Now, there are some things that are not modifiable that are associated with an increased rate of BPH. Some of them are familial. You can't change your parents, no matter how hard you try sometimes. So it does tend to run in families. It is more common in men with a family history of BPH, as well as interestingly enough, it is more common in men with a family history of bladder cancer, not prostate cancer, but bladder cancer, for reasons that we don't fully understand. And it is more common in certain races and ethnicities. So African American men have higher rates of BPH than Caucasian men, who have higher rates than Asian men. So those are just factors that we don't fully understand, but it's things that we've noticed.
So again, if you have any questions, if you're experiencing something, I mean, it's best to talk with your doctor.
Yeah, and I didn't actually, sorry, you didn't ask about that, so I didn't talk about the symptoms of BPH, but I probably should.
What are the symptoms?
Yeah, thanks for asking, Claudia.
There you go.
So the symptoms of BPH, the main symptoms that I see in my practice are people come in just complaining of the force of their stream is decreased. So they may notice that they're dribbling more. They may feel sometimes that they're not completely emptying their bladder. They may have urgency, so what we call urgent continence, when you feel like you got to go. There used to be a great ad, got to go right now, and that was for Flomex, I think, back in the day. I'm dating myself because that was one of their first commercials when they first came out. But that was one of the symptoms of an enlarged prostate is you just feel like when you have to urinate, you really have to urinate, and you better hurry up and get to a toilet. But those are the main symptoms of anything that seems to affect the force of the urinary stream or the ability to completely empty your bladder.
Very good information, really important to know that. Thank you. And speaking of a prostate, I mean, prostate cancer is one of the most common types of cancers, and it is the second leading cause of death after lung cancer in men in this country. Dr. Biehl, what causes prostate cancer?
Well, changes in the DNA of prostate cells are what cause cancer in prostate cells. And these changes lead to the cells growing and dividing more rapidly or not dying off fast enough. And there are a variety of factors that contribute to some of this, some of which we know about and some of which we don't.
And what are the risk factors?
So the risk factors, again, like Dr. Oppenheim just said, some we can change, some we can't. One risk factor is older age. Men over 50 are at a higher risk of developing prostate cancer. Race, again, comes into this, and black men are at higher risk of developing prostate cancer and also having worse outcomes even with the same treatments as other people. Family history, men who have a family history of other men in their family having prostate cancer, or even having a significant history of multiple women in their family having breast cancer. Certain genetic changes like BRCA1 and BRCA2 changes can increase the risk of that. And then obesity seems to increase the risk for prostate cancer and certainly has an effect on how patients do with their treatment for prostate cancer. The patients don't seem to do as well if they suffer from obesity.
So Dr. Oppenheim mentioned the signs and symptoms of an enlarged prostate, but what are the signs and symptoms of prostate cancer?
Well, sure. So first of all, for an early stage prostate cancer, generally patients present with no symptoms related to the prostate. For later disease, they can have trouble urinating, like Dr. Oppenheim mentioned, with BPH, difficulty getting started with their stream or having a weak stream. Blood in the urine or in the semen when they ejaculate, erectile dysfunction, bone pain and weight loss for people with very advanced disease.
Bone pain, where is there a general area for that? I mean, if it's advanced cancer, right? I mean, because I know we'll be discussing that in a little bit.
Yeah, what we're talking about here are patients who have cancer, prostate cancer that's metastasized to their bones. So it could be anywhere in the body. The most common sites for metastases are where there are more bones, such as the spine, the pelvis. Other areas are just as likely to have a metastasis, but they're smaller bones in general.
Okay. What is the average men being diagnosed with this type of cancer?
So average age, I actually had to ask Dr. Biehl this one because the average age is 67, but it is more common as men get older. So the saying or the statistics suggest that your risk of getting prostate cancer are basically the same as your age as a decade in life. So when they've looked at autopsy studies of men who've died for other reasons, so men who die either from a heart attack or from automobile accident, there have been some very large studies, and they look at the prostate and they look at the incidence of small, undiagnosed or non-clinically significant cancers. And men who are in their 60s, sixth decade of life, they have about a 60% chance of having prostate cancer. If you're in your seventh decade of life, so 70s to 80s, you have about a 70% chance of having a very small prostate cancer seen on autopsy studies. So your risk does go up with age. 11% of men will be diagnosed at some point in time of their life with prostate cancer. So it is a very common cancer.
Very common cancer. When should men start being screened for prostate cancer?
I knew you were going to ask this one. So there's a lot of controversy about prostate cancer screening. I like to say I've been doing this long enough that I've seen the pendulum swing all the way from when I first started off in medicine many years ago. We did not recommend routine prostate cancer screening. Then there was a time that we recommended screening for everyone starting at age 50. Now the U.S. Preventive Services Task Force does recommend a shared decision-making model with patients and their doctors, and they do not recommend routine screening currently for that. So the reasoning is it's hard to explain, but it's part of it is the nature of prostate cancer. If you're looking at a screening tool for cancer, you ideally want to be able to find a cancer early when it's most treatable. So a great example is breast cancer screening. We do know that if we find breast cancer in women early in the stage of breast cancer, it makes a huge difference in outcome. So women who have their cancers found early do much, much better than women who have their cancers found later. So that's where mammography is so important. Same thing with colon cancer screening. If we find a colon cancer when it's still a small polyp or a small growth in the colon, you can take that out. You can do localized treatments or chemotherapy or radiation, and you have very excellent cure rates. Prostate cancer, though, is something different. It tends to be, for most men, especially in older men, a very slow-growing cancer, and the 5-year survivability rate of prostate cancer, and this is men who are diagnosed at any age, about 98% of them are still alive 5 years out. And so part of that's due to the nature of prostate cancer. Part of that's due to the age in which men are when they get diagnosed with it. So it's more common, especially if you're an older man, you're more common to die from something else, or as we say, you're more likely to die with your prostate cancer than from it, especially for older men. That being said, men who have a strong genetic predisposition to cancers like BRCA2, or a strong family history of prostate cancer, or who are symptomatic earlier on in life, they tend to have more aggressive types of cancers, and it's more appropriate to screen or be aggressive for treatment and screening in those age groups.
Very interesting, thank you. Before we started with this program, Dr. Biehl and I were talking about screenings and how some groups tend to, not want to undergo those types of screenings, and it could be cultural. But do you want to talk a little bit about that, sure, Dr. Biehl?
Oh, okay.
Or Dr. Oppenheim.
Well, yeah, I was going to say
either one.
No. I was going to say the one thing we didn't talk about is how do you? And I forgot. I'm sorry. I said it in the Spanish version. I forgot to say it in the English version. There are different ways to screen for prostate cancer. One is a blood test, and that's the one that most men tend to choose. It's easy. We're drawing blood. Usually if you're seeing your family doc, we're usually drawing blood for something else anyway, and that's one of the ways that we do prostate cancer screening. And that's helpful because a higher PSA is associated with things like prostate cancer. Unfortunately, a higher PSA is also associated with other benign conditions like BPH, which is fairly common as well. The other way we screen for prostate cancer is what's called a digital prostate exam, and that's where the doctor does feel the prostate through the rectum. And that's, as I say, I've done a lot of them in my practice. I haven't killed anybody yet with them, but it's not a fun exam for anybody because it's uncomfortable.
It's uncomfortable but necessary, and it can save lives. So that's, I think, really important to mention. Okay, well, thank you for that.
Sure. So I'll address that a little bit too. So Dr. Oppenheim spoke a little bit about some of the other groups that make or recommend PSA screening more regularly. And that's that major group that's out there is the urology group, and they with some good reason they make the recommendation to continue screening at 50 years of age. Usually if you're going to see a urologist, you have some symptoms, and we already talked a little bit about the symptoms of both prostate cancer and BPH, and if you're starting to have those symptoms, then I think it is very reasonable to go ahead with PSA screening at that point. That's more of a directed type screening.
Okay.
I've had many an interesting discussion with my urological colleagues about this. So, and it is. And what I would say to people is, obviously, if you have concerns, you have questions, talk to your doctor, because I agree with Dr. Biehl that directed screening approach is absolutely appropriate. And the pendulum may swing back again in a few years as we get more information, and that's sort of how medical science works. Is we make the best recommendations based on what the data and the science shows us, and what the science shows us changes over time because we get more science, we get more data, and we get to interpret it.
Okay. Well, before we move on to the next topic, for our viewers, if you have any questions, please send them our way. We will read those questions, and our experts will try to answer most of them, of course, depending on time. So I do want to talk about some of the treatments available for prostate cancer. Dr. Biehl, I think you can talk about this as well. I mean, if a man is diagnosed at stage 2 or 3, what normally happens then? I mean, what's the treatment? What are the options? And then we can go on from there.
Sure. So for prostate cancer, when I start to talk to patients about different treatment options, I sort of break it up into what stage they're in, or what grade group they're in, is how we talk about it these days. And it really depends on what their cancer is and what it looks like. So for early stage cancers, there are several different options. We sometimes talk to patients about surgery or radiation, but one option that I often talk to patients about is called active surveillance. So when a patient does get screened and they are found to have a prostate cancer, they go through a process where they usually will check the PSA, and then they'll get a biopsy done after that. And the biopsy shows cancer. And if it's a lower risk type of cancer, one of the options is something called active surveillance. Now, getting back to this screening phenomenon, what we would really like out of a screening test is something that helps us find the cancers that will benefit from treatment. Yeah. And in many ways, that's sort of the downfall of the PSA, because it doesn't always tell us, is this patient going to benefit from radiation or surgery, which are the two major options for prostate cancer. And so we sort of have a surrogate for that, in that we can follow the PSA, we can do MRI scans, we can do further digital rectal exams, we can do further biopsies. And if the cancer begins to look more aggressive, then we start to recommend those treatments of surgery or radiation. So as it progresses down the line, that's where we really get into the point where we make a decision. And for intermediate stage cancers, surgery is one of the options, radiation is one of the options. Sometimes we add in things like hormone blockers. For more advanced cancers, I generally recommend radiation with the hormone blockers, and for the most advanced cases where the cancer's already metastasized to other places in the body, I generally recommend hormone blockers, possibly with directed radiation treatment, chemotherapy, or other immunotherapies or other directed treatments. These treatments have been being developed over many years, and we're still trying to find new treatments that will help our patients even more.
If a patient was diagnosed at an early stage, or maybe not so early, but they had the surgery, they underwent radiation therapy, years go by, the cancer returns, it's a higher stage or a late stage cancer, what usually is the treatment then? I mean, I know you mentioned hormonal blockers, but is that consistent, or are there other treatments afterwards for that person who's now a stage 4?
Yeah, so if we're talking about, there are different ways the cancer can recur. So it can recur locally, where it's only in one little area, and then you still have the other option on the table that you didn't take before. If you had surgery first, then you have radiation. If you had radiation first, then there are other options. If it's already metastasized, then yes, we almost always recommend the hormone blockers for those cases.
And so can you explain what the hormone blockers actually do? I mean, in terms of the cancer, what is their function?
So the prostate is a male sexual organ that helps to form and process the ejaculate that men produce. And that process is affected by male hormones, testosterone in particular. So when we give hormone blockers, there are a number of different options for the hormone blockers, and they stop the production or the presence, or they block the interaction of testosterone in the prostate gland. And in that way they can stop the growth of cancer cells, both in the prostate gland or elsewhere in the body if the cancer is metastasized.
Okay. Your practice, Coastal Radiation Oncology and SVMH are collaborating and are offering a clinical trial to certain men diagnosed with prostate cancer in our community. Can you please tell us, Dr. Biehl, about this clinical trial and who is a candidate for it?
Yeah, I'd love to. Ever since I first got here to Salinas about 10 years ago, we've been we introduced a new treatment technique called Stereotactic radiation treatment. We've done it in the past for the lungs, to the brain, to the liver, and other areas in the body. And there's a new national clinical study that we're participating in that helps give radiation treatment to the prostate using the same process called stereotactic radiation treatment. And this stereotactic treatment cuts down the number of days that you have to have radiation treatment. You know, in the past, we've had to give radiation over 28 to 45 days, and now we're able to give it over a total of 5 treatments with this new way of giving the radiation treatment. And we've been doing it for a while, and we're the only group in the Monterey Bay area that is offering it on this new national clinical trial. We're really excited about it. You know, it's been shown to be safe, and our patients have done really well in these cases. And we just with this new study, we're making sure that it's equivalent to, although it looks already like it's probably a little bit better than some of the other radiation treatment options.
Well, that's great news. And the other good news is that for those patients participating, they don't have to travel somewhere else, right? I mean, they're staying right here.
Yeah, it's the same clinical trial that they offer in other large academic centers along the West Coast, using the same machines and the same technology.
Very good. Well, we do want to stress the importance of cancer screenings. We at Salinas Valley Memorial Healthcare System think this is very important to get your yearly checkups and cancer screening. It's estimated that 41% of adults in the U.S. have delayed or avoided medical care because of the pandemic. Our healthcare system has proactively put processes in place that are working to keep you healthy and safe. And those processes are also there to keep our staff safe. We want to stress that it is safe to return to our offices to get those regular cancer screenings. Sadly, 1 in 3 Americans will get cancer in their lifetime. So as you mentioned earlier, finding cancer early means that it can be easily treated. So again, I know that you've said this before, I will say it again, we encourage you to talk to your doctor about what cancer or what screening exams are right for you, but please do not delay medical care. I do want to dedicate some time now to answering some viewer questions here on Facebook. Someone here is asking, is prostate cancer curable?
Yeah, absolutely.
Yes.
Prostate cancer
I like
is curable.
hearing that.
It
Yes.
depends on the stage and where it is. And as Dr. Oppenheim said earlier, you know, sometimes the question is it something that we even have to cure? You know, if you're diagnosed with prostate cancer at age 90, you know, and it's a low-risk prostate cancer, then I'm going to tell almost all of those patients that it's unlikely that they even need treatment. Now, if you're 50, 60, you know, there's some other things we look into to determine what the benefit of treatment's going to be and how much you're going to benefit from a definitive curative treatment like radiation or surgery.
Right. As Dr. Biehl said, and even if we can't cure it, it certainly is predominantly the type of cancer that you can live with. Yeah.
And as you mentioned earlier, you can die with this cancer,
Right.
meaning you can die of something else and still
Right.
live a full life. And
Yeah, and it's primarily because it does tend to show up in older men, and unfortunately, as we get older, we tend to have more medical conditions. So it isn't happening in a vacuum. When an 80-year-old or a 70-year-old gets prostate cancer, unfortunately, he tends to have diabetes or high blood pressure or cholesterol issues, other things going on. So.
okay. I have another question here, and you did discuss this earlier, but perhaps some of you out there started watching this a little later, so you may have missed that, so I'll ask this question. What is BPH, and is it cancerous?
Great question. So BPH stands for benign prostatic hyperplasia. We used to call it hypertrophy, and for reasons that nobody really cares about, we changed the last word from hypertrophy to hyperplasia. But basically, in plain English, it means an enlarged prostate that's not cancerous. So as men get older, our prostates get bigger, and for a variety of factors. Some of them are factors that you can change, such as diet and lifestyle. So being more sedentary, drinking more alcohol, smoking, having metabolic conditions such as diabetes or hypertension or high cholesterol, all associated with increased risk of BPH. Other factors which are not modifiable are race and ethnicity and family history of BPH, but all of those seem to contribute to an enlarged prostate. We don't fully understand why the prostate gets bigger. It seems to be a combination of hormonal factors. We think there may be some low-grade inflammatory factors. There may be an autoimmune process. This is an area that's obviously continues to get a lot of focus and study to better understand how and why the prostate enlarges. We do have a lot of medications available for prostatic enlargement. There's a number of medicines out there and available. Your family doctor or your urologist can all prescribe them. We're all very comfortable with them. For men who don't respond to medication, there's surgical options that are done through the urethra of the prostate, through the urethra of the penis, sorry. And they kind of either scoop out portions of the prostate or kill off tissue through laser or what's called radio ablation, which is radio frequency waves. It's not I don't do it, so I can't say I fully understand it, but there's a lot of options out there for men who have these symptoms. So if you're suffering from the symptoms, and just in case you missed it, the symptoms would be difficulty urinating, feeling like you can't completely urinate, some dribbling after urination, or urgency, feeling like when you got to go right now.
And
Like that
up,
song.
And waking up at night
Yep.
multiple times to urinate. So, but the fortunate thing is that you don't need to see an oncologist like me if you have BPH.
Right. We do say that it's normal for men, basically over 50, to waking up to twice a night to urinate can be normal. But if you have concerns, obviously come see your doctor. But if you're listening to this saying, "Oh, gee, I wake up in the middle of the night to urinate," that doesn't necessarily mean that you have a disease or anything's dangerous. That can be normal. But if you're waking up 4, 5, 6 times a night, you should definitely come in and be seen.
Okay. Here's another question. What's the most common myth men believe about their health? You're speechless.
No, I'm thinking. Sorry.
It's a good question.
Yeah, that's a really good question. I wouldn't necessarily say. I think here's what I see in my practice, and I'm going to answer your question as best I can. Sure. I think the most common myth that men have about their health is that treating an illness means that they failed as a man. So I've seen this, and I actually experience this, and I tell this to my patients, and I have no problem sharing this with Facebook Live as well. I exercise, I'm vegetarian, I sleep well, I don't smoke, I actually don't drink alcohol hardly at all, and I've still got high blood pressure, high cholesterol, and heart disease. Now, I'm 3 years older than my father was when he had his first heart attack, and I had a grandfather who had not 1 but 2 bypass surgeries. So, I did not win the genetic lottery when it came to heart disease. So I'm trying to play the cards I dealt as best I can, and I did all the lifestyle factors. And I appreciate that when the time came to start cholesterol-lowering medication or when the time came to start blood pressure medication, that was a hard pill to swallow. And we as men don't like to do that because we like to think that we're strong enough or we're, fill in the blank enough that we don't need it. So I think the greatest myth that men have is that they need to, that starting medication or starting treatment means they failed some way or shape, and that's not the case. There are many things that you can do to live healthier, and you absolutely should. But if they're not enough, then working with your doctor to start treatment is absolutely appropriate. So that's a great question.
Oh, and thank you for sharing that very personal information about yourself, Dr. Oppenheim. We appreciate that.
Sure.
Do you have anything to add, Dr. Biehl, to that question?
I've been trying to think if there are any specific myths, and I can think of a few, but they've been very particular. I think probably the biggest thing is whatever myth is keeping you from seeing your doctor and taking care of your health or whatever is keeping you from doing that is going to be the most important thing for you. I mean, it could be like Dr. Oppenheim said. If we feel like we failed when we have to go see the doctor, then the failure is not seeing the doctor, and not making the changes that we can make to live a healthier life and a more enriching life that we can if we do that. So yeah.
Okay. We have another really good question here on Facebook. You constantly hear advertising for over-the-counter products for prostate health. What benefit, if any, do they provide, and how beneficial are they for treating and preventing BHP?
None.
There you go, none.
That's right.
Okay. Well, thank you for that question.
I can say it longer in many different ways, but no, that's the short answer. The long answer, there was some data initially about saw palmetto that did seem to show some promise, but later studies didn't bear it out. But this is what I tell people. There are things you can do naturally, holistically to be healthier, not just in terms of prostate, but your health overall. And the same things that will help your prostate will help your basically your lifestyle overall, which is, eat right, get plenty of sleep, don't smoke, alcohol in moderation, maintain a healthy weight and exercise regularly. That will help your prostate, that will help your heart, that will help all those things. There's a huge industry out there trying to sell you stuff, saying that take this pill, it will treat you naturally. Now, I am yet to see a tree or a plant that grows that pill, so there's absolutely nothing natural in that pill. If you want to treat yourself, if you want to be healthy naturally, do the things I just talked about. Eat a healthy diet, predominantly plants. Try to avoid processed foods. But just taking vitamins or supplements isn't a substitute to having a healthy lifestyle. You can't have a bag of Cheetos and then pop a multivitamin and think you're doing fine.
Okay, thank you for that.
Yep.
Was there anything else you wanted to say there, Dr. Biehl, that I enjoyed?
No, I think that covers it.
Okay.
Not that I have anything against Cheetos. I love them, but just in moderation.
Just checking
In
to make
moderation.
sure I don't have that orange cheese on
I'm
my
looking.
hands.
I'm looking at your fingers.
Okay, I think we have time for one more question from our viewers here. Should men diagnosed with cancer receive the COVID-19 vaccine?
Yes, absolutely. So I'm a strong advocate of the COVID vaccination. So men with cancer absolutely should receive the COVID-19 vaccination. There are very few contraindications to getting COVID-19 vaccination. I think it's really important that everybody, especially patients with chronic medical conditions, get the COVID-19 vaccination. I think it's the concern that I have is if folks are avoiding getting vaccinated because they're worried that they have an underlying medical condition, what I would say is that if you were to get infected with COVID-19 infection, you would be at more risk of having a complication because of being debilitated due to an underlying medical complication. So if you have any questions, ask your doctor, but absolutely you should get vaccinated. I know there's a lot of information out there on the internet, Facebook included, where people are calling into question and trying to create a controversy about the vaccination. When you look at the sort of the straight up the medical community, There's very little, if any, controversy about this. We all think this is the best thing. You absolutely should get vaccinated. You ask any doctor who practices medicine. Yes, I know there are people who have MD behind their names that are saying some strange things on the internet. My friends show me their articles, and these are not practicing physicians that are treating patients that are really looking at the science behind it. I understand there is still a lot of fear and concern because it's, especially with the mRNA vaccines, that they're new and a little bit different. The science for them has been around for years. It's just been mass produced now because there was a need and it was the fastest way to get the vaccines out. We've now given somewhere between 2 to 3 billion shots worldwide, and we are tracking side effects and complications related to the vaccines very closely. I myself had to fill out questionnaires for 2 months. I was getting them on my cell phone. How are you checking in? Are you having any side effects? How do you feel? So this is one of the most studied vaccines worldwide, and the side effect rates are incredibly low. We hear about them on the news. We've heard about them when there's 6 cases of this or 12 cases of that. And that's because they're newsworthy, because they are actually so rare. This does seem to be an incredibly safe and effective vaccine, and I recommend everybody get it.
So do I. Early on when I got my vaccine, I was super excited because I knew that I'd be able to help protect my patients who are cancer patients. And those cancer patients are at very high risk of developing complications if they contract COVID. So I was really pushing as early as possible for my patients, especially the newly diagnosed patients who had cancer, who had recently been diagnosed with cancer, particularly patients who've gotten treatment for cancer like radiation or chemotherapy are at extremely high risk of complications if they develop the COVID. So it's certainly something that I recommend to all patients, but to patients with cancer in particular.
Okay, that's great advice. Thank you for that. I know that when I received my vaccine, the side effects, speaking of side effects now, was just utter happiness.
Yeah.
And a slightly sore arm, but that's about it. So I definitely encourage our viewers, if you haven't gotten your vaccine, please get that shot in your arm. I think our doctors, as you just heard, absolutely feel that same way too.
Absolutely, and Claudia, we talked about this before the show, but when I got the vaccine about 12 hours after my second dose, I got the typical flu-like symptoms with achy bones and achy muscles. And I remember actually being really, hate to say it, being really happy because as I sat down on the couch, I watched TV for about 12 hours. I felt better afterwards, but I knew that my immune system was working as designed, creating antibodies, and that I was going to be protected against the vaccine. So it was actually, for me, actually I wouldn't say fun experience, but it was certainly very comforting knowing that I was going to be immunized, and it was a great feeling.
That's right. Okay. All right, and speaking of the vaccines, I do want to share with our community that Salinas Valley Medical Clinic is currently administering the COVID-19 vaccines to all Monterey County residents who are eligible. So if you are eligible and you still need that vaccine, please go to myturn.ca.gov to register and to make an appointment. Those vaccines are being administered at our SVMC Orthopedics, Podiatry, Spine, and Sports Medicine Clinic in Salinas. The address is 611 Abbott Street. Walk-ins are, of course, welcome. We're also giving vaccines to kids 12 and older. That is the Pfizer vaccine. We do ask, of course, that those kids be accompanied by a parent or guardian. And just to wrap things up, I do want to thank our viewers, obviously, for tuning in and for sending us some very interesting questions. We have one viewer here, Carol, says, "I've learned so much. Thank you." And Leon Ramirez, you're asking if this could be bilingual. You actually can watch the Spanish version of this presentation if you just go up a little on your Facebook page. That was recorded live about an hour ago, actually, so you can get that information there. I do want to thank our experts, our bilingual experts, Dr. Kenneth Biehl and Dr. Peter Oppenheim. Thank you so very much for being here today, for taking the time to be here. We really do appreciate your advice and your expertise. Our next Ask the Experts virtual event, also in English and Spanish, will be taking place next month. Dr. Carla Rosal from SVMC Prime Care Monterey will be focusing on kids going back to school during the pandemic. The English language event will take place right here on Facebook at 3:30 p.m., the Spanish version at 2 p.m. We hope that you can join us for those free virtual presentations. This video will remain here on our Facebook page. Please watch it again if you have any questions. Share it with your friends and family. We really do appreciate it. And we'll see you here next month. Take care. Bye-bye.
Thank you. Thank you
Bye-bye.
very much, Claudia.
Thanks for having us.
Thanks for having us.
Thank you.